please give a warm welcome to our keynote speaker, Mariana Chilton.
Good morning, everyone. My name is Mariana Chilton. I'm on the faculty at Drexel University School of Public Health. I'm an associate professor there. I'm the director of the Center for Hunger-Free Communities, which is a center that's been around for about 10 years. And we focus on research and advocacy and civic engagement all around maternal and child health issues and food insecurity. Today I wanted to discuss the undiscussables. Because I'm not a nutrition educator. I'm primarily I'm an epidemiologist and I'm an anthropologist. And I work in a variety of different settings, primarily doing research. And I talk with caregivers of very young children under the age of 4 in hospital settings and also in people's homes. And also as an anthropologist, I go to the food cupboards around Philadelphia. When I first moved back to Philadelphia over 15 years ago, I volunteered at the food pantries and got to know the families that way and would often carry home their groceries and talk with them about their experiences. So today I'm going to talk about my epidemiological research and also my qualitative research and tell you what's going on underneath. And I think many of you must know some of the hardships that are really happening. But since all of you are primarily focused on families that are low income and are funded through the SNAP Ed program, I think you know a lot of these issues. So forgive me if I am lacking enough nutrition education to inspire you, but maybe what we talk about today can give you some insight into the families that you work with. So first, I'm going to talk about food insecurity and explain how food insecurity is not just about not having enough food. We have to think way beyond food if we really want to be helping families to eat better. I'm going to talk about the health impacts of food insecurity. And I love talking about SNAP, or food stamps, because SNAP really works. And I love this hashtag, and I often use it. So if you're ever on Twitter, every now and then, just do hashtag SNAP works, just for fun. Just to call together your sisters and brothers in nutrition education and in SNAP policy. And then I want to talk about what I've learned from the families of witnesses to hunger. And that's when we're going to start discussing the undiscussables. Many of you know about this program, but if you don't, I'm going to give you a little bit of background on it. And then finally, I may talk about the way forward, or I'll talk about some of the solutions that I've been doing. Again, the solutions that I work on actually have zero to do with nutrition education. They're more about empowerment, financial empowerment, self-empowerment, and helping people to gain more political power. So all of you know that back in the, really only 50 years ago, there were still children in the United States that were dying of starvation, suffering from severe malnutrition, kwashiorkor. And you may know this wonderful there was a little video that the Center on Budget and Policy Priorities put out years ago commemorating the history of SNAP. That was for the Farm Bill a couple of Farm Bills ago. And it was featuring a documentary by Charles Kuralt called Hunger in America. And they really did show a lot of kids suffering from severe malnutrition. They literally showed a child dying on camera, dying of starvation. And they talked about other things, and I think some of you have heard me talk about this slide before, so I'm not going to talk much about it. But what we have to remember is that thanks to SNAP, thanks to food stamps, we do not have children suffering from severe malnutrition, unless it has to do with failure to thrive. And I'm not going to talk about failure to thrive today. Their failure to thrive is still pretty prevalent, especially in low-income communities. But really, we just do not have the severe malnutrition that we used to have, thanks to SNAP. It's the 50th anniversary of food stamps, and shout out to WIC, it's the 40th anniversary of the Women, Infants, and Children program. These are fantastic public health programs that don't get enough play in the public for their health impacts, and I'm going to talk a little bit about that today. So what is food insecurity? Food insecurity is lack of access to enough food for an active and healthy life. It has to do with the concept of enough. That's what people think about when they think about hunger. Families don't have enough food. But it's also about having the right kinds of food for an active and healthy life. So food insecurity in and of itself picks up components of health and well-being, anxiety and worry as well. So it's not just about having enough, it's also the worry about having enough food, and also it has to do with diet quality. And I know you probably can't see some of these terms, but I'm going to come back to this at the end, so I just want to just tip you off right now, just make sure you understand the severity levels of food insecurity. Don't pay attention to the top two rows. If you look at household food insecurity, there are two levels of household food insecurity. There's something called low food security, and that's when families can reduce the quality and the variety and the desirability of the diet. And then there's this other concept of very low food security, and that means lots of indications of disrupted eating patterns and reducing food intake. That means skipping meals. That means potentially not eating for a whole day. That means experiencing hunger but not having enough money for food. For adults, it can also mean losing weight because there's not enough money for food. And then there's a food insecurity among children. I'm not going to talk about that today because it's down in the weeds. But you should know that households that have children in them, if they are reporting food insecurity at the household level, it has a direct impact on the health and well-being of young children, regardless of whether the parents think their child is food insecure. Those of you who heard me several years ago talk at this conference may remember that there was this term called hunger in the food insecurity measure. If you want to talk about it in the question and answer session, we can. But very low food security, sort of the severe form of household food insecurity, used to be called food insecurity with hunger. We'll talk about it later. All right. In the general population, about 16% of households reported food insecurity. For children, it's far worse. For households with children under the age of 18, about 16 million households reported that, about 23%. And households with very young children, that's children under the age of 6, have very high rates of food insecurity, about 23% as well, 8.2 million. Very young children are in households with food insecurity. Remember, I focus on families with really young kids. And there are major racial and ethnic disparities. There are disparities by household type. The highest bar here is the rate of food insecurity for female-headed households, about 34%. Families with the younger the children, the worse food insecurity becomes. For Latino and African American households, they have 2 to 3 times the rates of white households. That's not in terms of sheer number. There are far more white children that are experiencing food insecurity in the United States by sheer number. But if you look by the burden on the population, African American families and Latino families have much higher rates. And for those of you in public health, I put the Healthy People 2020 target of 6%. We missed the 2010 target, but there was no uproar from the public health community. I hope we can talk about that too. It's hard to get a sense of the magnitude of food insecurity, and a lot of people kind of tune out or worse, don't believe it. So I just want to give you a sense of the magnitude of poverty and of deep poverty. Just let's consider Philadelphia. At the height of the recession, there were 44,000 children under the age of 6 living at the federal poverty line and below in Philadelphia alone. So 44,000. Well, what does that really look like? Well, those of you who are Phillies fans may recognize the Citizens Bank Stadium. Go Phillies. Next time you're watching them on TV, or maybe next time you're sitting in the stands, just do an imagination exercise and just populate the entire stadium with infants and toddlers and preschoolers, little kids in blankies sucking their thumbs, or getting, talking with each other, kind of poking each other. Just imagine it. And you can get a sense of the magnitude of poverty in Philadelphia alone, and then just think about the rest of the United States. We have big problems. Food insecurity is related to children that are in food insecure homes suffer more health problems, more headaches, more colds, higher hospitalization rates. They suffer from more psychosocial and behavioral problems. They have trouble getting along with their peers. They have trouble in school, greater need for mental health services, and not only are there social and psychosocial issues, but children who are in food insecure homes do not perform as well as their peers in language arts and in mathematics. All right, I want to talk about families with really little kids, because those first 3 years of life are the most important for brain development, for cognitive, social, and emotional development. And any kind of nutritional deprivation during this time has lifelong consequences. So if you think about brain growth, 2/3 of the brain grows after birth. During this time, infants and toddlers are growing neurons at about 700 neurons a second. It's an incredible window of time. And all of us have already lived our 3 most important years of our lives. And we don't remember a thing about it. So I'm going to introduce you to the concept of toxic stress. I'm not going to come back to it until the end, right, when we get to the undiscussables. But on the left-hand side, you'll see a typical neuron. It's got lots of synapses going off, and it's lots of diversity, lots of things going on that will then later be pruned. On the right-hand side is a neuron that is experiencing toxic stress. That's severe adversity. I'm going to explain to you in a second. When children have any kind of nutritional deprivation or maybe experiencing homelessness or abuse or neglect, are not as likely to develop as many neurons. So that's a distressed neuron. It has major impacts on brain growth and the growth of organs. So I'm going to tell you a little bit about our research from Children's Health Watch. It's a multi-site study. We're in Boston, Baltimore, Philadelphia is the site that I run, Little Rock, and Minneapolis. And actually we've talked to over 70,000 families across the country. And what we do is we monitor public assistance participation, and we see what the impacts are on the health and well-being of very young children. So we track the impact of SNAP participation, WIC participation, housing subsidies even, and we see how those are related to food insecurity rates, child development, maternal depressive symptoms, and even child growth and child development, cognitive, social, and emotional development. These are some of our interviewers at St. Christopher's Hospital for Children. It's sort of direct contact, hanging out, talking to the moms and dads in the emergency rooms that are bringing in their young people, their young toddlers. And I'm just skipping straight all of those methods and going straight. I think this is one of the, well, I'm showing a few charts. But basically, what I already said before, families that are in food insecure homes are more likely to report their children to be in fair or poor health, more likely to report hospitalizations. And the moms that we're measuring, where we're measuring depressive symptoms, are almost 3 times as likely to report depressive symptoms than mothers who are not food insecure. And also major problems with child development, cognitive, social, and emotional development. So the damage of food insecurity happens long before a child crosses the threshold of kindergarten. So it's wonderful that we may think about school breakfast and school lunch. Sometimes the damage is already done before kids are already getting there. We've got to make sure that we're really focusing on women and men and their little kids and what's going on in those years of life before they get to school. Now, there's some other nutrition programs that we could talk about if you want to in the discussion. Back to toxic stress. Toxic stress is the strong and frequent and or prolonged adversity without adequate support. So that includes child abuse and it includes neglect, but it also includes family hardship. All of those things affect the brain architecture and the organ systems and are associated with stress-related diseases later on in life. And I'm not just talking about depression, anxiety. I'm also talking about diabetes and heart disease. All right. In Children's Health Watch, we don't just focus on food insecurity. We've also come up with a measure of housing insecurity, where a family has moved more than 2 times during the year, or they're behind on rent, or they're in a shelter or on the streets or couch surfing. We also measure energy insecurity, and that's when families have received shut-off notices or are living without running water, without electricity. This trio of things, this is the big trio that we're looking at. Food insecurity, housing insecurity, energy insecurity, and all of these things are what we consider to be landing little kids into the hospitals. all of these insecurities are preventable. Okay, so let me just give you an example of housing insecurity and how it relates to food insecurity and why you've got to think beyond food if you're working with really low-income families. Okay, so stable housing is the yellow bar, moderate housing insecurity is the orange one, and severe insecurity is the pink one. So left-hand side is household food insecurity. Those who are reporting severe housing insecurity are far more likely to report food insecurity. Same thing with the child's health being in fair or poor condition. And the same thing with developmental risk. 75% increased risk for poor cognitive, social, and emotional development because a family is insecure in their housing. Okay. What we often do is we translate this research for policy solutions. We try to take all of our peer-reviewed research and translate it into messages that congressional staffers can understand when they're working on their policy solutions. You all understand that basically you're probably doing the same little two-step that we do at Drexel, which is child nutrition reauthorization, farm bill. Child nutrition reauthorization, farm bill. So right now, child nutrition reauthorization is up for reauthorization this summer. Whether we get to it or not is another story. Child nutrition reauthorization funds school breakfast, school lunch, after-school feeding programs, the summer feeding program, the child and adult care food program, and WIC. The farm bill funds the food stamp program, or SNAP. All right, so what we do is we try to create these little bumper sticker messages, actually in the form of 3 pages, 3-page reports, when we say things like, food stamps are good medicine, so that people in Congress can understand that this is not simply a welfare program. This is not something that we should be concerned about abuse of the program, but actually it's good public health. Food stamps are good medicine because we know they improve child health outcomes. We know that WIC protects against underweight, promotes child health and development, and we have found out recently it reduces maternal depressive symptoms. How about that? We know that energy assistance programs actually protect against food insecurity and poor child health, and also housing subsidies protect against underweight. But in Congress, the people who are writing these bills really have no understanding of the health impacts, or if they do think that there might be health impacts, they may not be thinking about it as the primary goal of our nutrition assistance programs, or even of housing subsidies or energy subsidies. And just a quick shout out to WIC. I don't think I've talked enough about it, but maybe we can talk about it in the question and answer. But we know that WIC improves outcomes in growth and improves child development, reduces maternal depressive symptoms. And a big shout out to the dads. A lot of dads are also showing up to the WIC offices and needing help. And maybe some of you are nutrition educators in our WIC offices and are seeing more men. And we're all starting to recognize that we don't have enough services for the men. We've got to do better. Oh, I've already said SNAP is good medicine. I'm not going to belabor the point. I stole this slide from Rich Lucas at the USDA, and I just wanted to give a shout out to what's called the Summer EBT program. Now, just don't look at the slide for a second. I'll explain to you Summer EBT. This was a pilot study that was done in rural areas that did not have good programming to allow for the summer feeding program to flourish. So most of you know that the summer feeding programs need to have a camp or some kind of an enrichment experience for kids when they're out of school in the summertime. And if there's an enrichment experience, then you can do summer feeding. So it's like school breakfast and school lunch during the summer. But in a lot of rural areas, they don't really have that. And so they thought, well, maybe we can just put a little bit of a boost on the EBT card, electronic benefits transfer card, primarily used for SNAP benefits, or TANF. If we do a $60 increase per month per child for these families, let's see what happens. So rather than rely on kids getting to a camp to get that food program, why not put more money in the pockets of their parents? What a concept. Okay, that's called Summer EBT. Well, it's had a very impressive effect they found that if you go down to the household level, I don't want to get down to the child level, the household, very low food security, it's the third row down, or the second one up. The percent change in very low food security at the household level for families participating in the EBT was a 32% decrease. That's a huge impact, and that's $60 a month. So that's related to food stamps are good medicine, right? Because that means more money, frankly, for food stamps, for those who are food stamp eligible. But it's attached to the summer feeding program, okay? So watch out for that. During the child nutrition reauthorization, let's hope that we're inserting summer EBT for all kids, all eligible kids. And for the nutrition educators in the room, kids who receive summer EBT had increased consumption in fruits and vegetables and whole grains and in dairy products. Good news all around. But hold the phone. That's all of the discussables, right? Oh, WIC is wonderful. SNAP is beautiful. It doesn't always work that way. This is a photograph from Witnesses to Hunger, and I'll explain it in a second. This is by Ashley Ortiz, who says, Mariana, this is my metaphor for welfare, for public assistance. And when families talk about welfare, they're often talking about food stamps. She doesn't have enough money to have a cell phone or a landline. This is the closest payphone. She's supposed to call the county assistance office to get recertified for her SNAP benefits, but how is she supposed to call? Let's say she borrows someone's phone. Of course, no one's going to pick up the phone. She's got to leave a message, right? And hope for a call back. How do they call her back? That for her is a system. The help is out there, but I can't get it. So let's talk about the Thrifty Food Plan. The Thrifty Food Plan, some of you may have seen this slide before from my work, is a little bit old. It's back from, I think, 2002, 2003. No, it's later than that. Basically, the Thrifty Food Plan is the allotment that the federal government calculates to suggest that this is the amount that families ought to receive. That is the minimal amount that families can spend to have a healthful diet. All right, it's called the Thrifty Food Plan. And it is basically the gold standard for the SNAP allotment, okay? So we did some research in Philadelphia, and we costed out if a family actually purchased the items that were listed in the suggested market basket for the Thrifty Food Plan, that at a supermarket, this is for the month, the actual cost of the Thrifty Food Plan is $772. Okay, at the time, this was before the ERA increase, so the increase in 2009 to the SNAP program. At the time, the maximum allotment was $588. That's the maximum allotment. That's if a family has no income. And it's actually pretty rare that families are receiving the maximum allotment. So let's say a family was trying to do right by what the federal government says they ought to be doing and purchasing the items that the federal government suggests that they ought to do, they'd be about $2,000 in the hole by the end of the year just trying to feed their families with the Thrifty Food Plan. Even with the increase that happened in 2009 during the economic downturn, when the federal government increased everyone's SNAP benefits on average about 14%, even with the SNAP increase, you still couldn't purchase the SNAP recommended items if you had all the money that you were supposed to have. It gets worse, of course, with medium grocery stores and small stores or corner stores. Overall, the Thrifty Food Plan is an inadequate assessment of how much families really need in order to purchase a healthy diet. We need to do some other things. I know you're going to hear about that later with Park Wilde and maybe some others about some incentivization programs to help boost the dollars that families can utilize to purchase fruits and vegetables, etc. Or maybe we ought to be writing Congress and have them change the Thrifty Food Plan calculation to something called the low-cost food plan. I can get into the weeds if you really want to. All right. What happens when families are cut off of food stamps justifiably because their income has increased? Okay? These are families from the Children's Health Watch survey. We asked them, did you lose food stamps because you had an increase in income? And this is what happened. These are adjusted odds ratios for those of you in public health. Those who had a reduction in SNAP, so reduction is the pink line, or the light pink, and lost SNAP is the dark pink. The increase in reports of the child being in fair or poor health for those that reduced SNAP is much higher. That had a cut in their SNAP benefits, and those who lost them completely because they had an increase in income. Look, child food insecurity is the most severe form of food insecurity. It's underreported. And if you look at this set of bars, you'll see that if a family lost SNAP, they were more likely to report their child to be food insecure. What's going on there? They just had a boost in income. How is it possible that they'd be reporting more child hunger? Sort of counterintuitive. And look at the developmental risk. So there's something very wrong with our system when families are supposed to be slowly gliding off of food stamps into self-sufficiency. They're actually not gliding off into self-sufficiency. They're going off of a cliff. And that's not just a financial cliff. That's a health cliff. Because of the way that the SNAP allotment, number one, is first of all calculated, but also because of what's going on when families are losing SNAP because they increase their income. That's another point of intervention. All right. So about 6 years ago, I was getting a little bit frustrated testifying before Congress with all these adjusted odds ratios. I've already bored you to death with some of those bars, I'm sure. On the Hill, we're called an expert witness, but that couldn't be anything further than the truth. I myself has never experienced hunger or food insecurity. So, and also I had been talking to families in the emergency room at St. Christopher's Hospital for Children in Philadelphia, and also in their homes, and learning about the brilliance and the brilliance of the families that I'm talking to, and the hardship. And I was trying to figure out a way, how can I get the families that I talk to come to Congress, or how can I get congressional staffers to come and sit in the kitchens that I'm sitting in? How to do that? Well, came up with the concept of witnesses to hunger. I utilized a photo voice methodology where I gave each, I started in Philadelphia, I gave 42 women a digital camera. And I said, you take pictures of what your experience is like. I'm interested in food and nutrition and food stamps, but you might be interested in something else. You have the camera, you have the ability to frame the issue, use the camera as your voice to talk about what it is like to raise your children in poverty, to participate in public assistance programs, and what your solutions for change are. So it's called Witnesses to Hunger. These are some of the moms that I work with in Philadelphia. Witnesses is now in Camden, New Jersey, Boston, Massachusetts, Baltimore, Maryland, New Haven, Connecticut, Texas, and Alaska. So it's a movement. These are some of the moms that I work with. And these are my professors. And these are the ones who insist that I talk about the undiscussables. Remember that when I gave cameras to the parents, I said, I'm interested in what your priorities are. What do you want to talk about? So let me show you some of the photographs. You can go to the website, Witnesses to Hunger, and plug in any word, and all kinds of images will come up. Some that have quotes, some that don't. We're still populating it. There are over 10,000 images and over 300 videos and thousands of pages of transcripts, but we'll get to it at some point. Part of the idea of Witnesses to Hunger is to make sure that the families can speak out for themselves, to take the mic themselves and sort of help to not only contribute to the dialogue, but actually steer what the dialogue needs to be about. We've taken our exhibit of photographs to the United States Senate. Here we are talking to Senator Harry Reid, Senator Casey. There's Derek Miller in the back. I don't know if you know Derek. Those are the ladies of Witnesses to Hunger, talking to different senators about their photographs. That was to inform the child nutrition reauthorization that ended in 2010. It was called the Healthy Hunger-Free Kids Act, but this was back in 2009. That's Imani Sullivan talking about applying for emergency food stamps with her son. She's got the photograph right there, and she's talking directly to Senator Casey. So there is a way that you can help low-income families speak out for themselves. You don't have to speak for them. They can speak for themselves if they're given a platform. Oh, and And that's Tiana Gaines-Turner, a member of Witnesses to Hunger, married, mother of 3, was invited to testify to the House Budget Committee that's chaired by Paul Ryan. That was back in July of 2014. What does she want to talk about? This is one of her photographs. She said, I want you to see my son when he was sick. When my son is sick, it's a disaster. Not only because he's sick, but that means that I have to be with my son at the hospital. It means I have to take off from work, be with my son at the hospital, but I've got 2 other kids. I've got little twins, so that means my husband has to take off of work to stay home with the twins. That means we don't make enough money. That means we have to then, at the end of the month, just say, figure out who's going to pay for the light bill, who's going to pay, how are we going to pay for the rent, how are we going to pay for food. So all of that clashing and that intersection of poor child health and being on a very low income. In this photograph, which she brought to this to the House of Representatives last year, she said, I want you to see the stress in my children's faces. Stress. This is, she says, we were homeless. This is the 2nd time we were homeless. And you can see it in my oldest son's face. He's the boy in the red hoodie. This is the 2nd time he was homeless. And you can see the stress. He's saying, what he's saying, this is Tiana's words, are we doing this again? They had just checked out of a hotel. You can see that they have the pack and play as the crib and their belongings dragging along the back. So this is a story about homelessness, but primarily about stress. This is a photograph by Crystal Sears. She said, I want people to know it's not all bad. Thanks to food stamps, she ate breakfast this morning. But if you just look at this photograph for an extra few seconds, you'll sense that this child is really hanging off the edge of a cliff. Yes, she's sitting on the floor in the bedroom that has missing its tiles, etc. If you go on the website, it's much better image quality. You can see that there's a doll lying on the floor face down. Looks like the little doll is sort of slamming the floor. But it's not all bad, because thanks to food stamps, she ate breakfast this morning. Those of us in public health who do nutrition education will want to take some time to look at the Coca-Cola sign where it says, we accept WIC and EBT. Not to mention the Sunkist sign, and in the windows you see tobacco ads. The families that we talk to are disgusted with the tobacco advertising and the soda advertising. This is where I go redeem my food stamps, and I'm sick of seeing this kind of stuff. Sick of seeing the beer advertisements and the tobacco advertisements. Actually, we have a man that took this photograph. This was Alonzo. And he said, this is such a great photograph. Look at the peaches. It was so great that this truck was coming by in the neighborhood and honking his horn. And we went out and we really wanted to purchase those vegetables. Why can't we have this kind of thing every day? This was a total random event that this person came to sell fruits and vegetables in our neighborhood. I want to be able to see this every day. This is just another picture of the chaos, the financial chaos, for-profit tax services, etc., tobacco, etc. But look, oh, there's a produce connection right in the middle of that, next to the donut store. Are we thinking about the environments that the families that we work with are living in? This is a screenshot of a video that was taken by Tiffany Ross. And it first started out, and you can see the feet of her little 2-year-old walking in sandals. They're walking to the corner store to redeem their WIC vouchers. And you see little dime bags that the little girl is walking past, and that's what she wants everybody to see. She wants everybody to see the dime bags. And then she takes you into the store with her as she's going to redeem. But in this moment, I grabbed this little screenshot because she says, I want people to know that when I go to redeem my food stamps, I have to part a sea of drug dealers. And they all know me. Hey, Tiffany. Hey, little girl. They know her daughter's name. But she doesn't like having to walk past them. Yeah, it's part of the neighborhood. If you think about Sesame Street and who are the people in your neighborhood, that's what Tiffany is talking about. These are families in my neighborhood. She knows these families. She knows these men. They're families in her neighborhood dealing drugs on the corner. And if you look very closely, those of you who are WIC educators, we accept WIC. WIC is a wonderful program, but are we thinking about the environments in which our families are having to live and to work and to play and to shop? This is a photo by Erica Smalley. She said, I want people to see the housing conditions. It's depressing. I hate walking down the street where I live. What does my daughter see? What do I see? This is depressing. I'd love to take one of these homes and fix it up. Photograph by Imani Sullivan. Remember the woman that was talking to Senator Casey? This is a photograph of a house that was in her neighborhood. She said, I took a picture of this house because I wanted you all to know that there was a family living in there with 3 children. No running water, no electricity, living in this house. And it had not been boarded up for months. A few months later, after she and I talked about this photograph, they did come to board it up. And it's still just boarded up with a lovely little bright orange sign that says L&I, Licensing and Inspection. Those of you from Philadelphia know those signs, right? Photographed by Whitney Henry. She said, look at the blood on the street. I was walking with my 1.5-year-old to the bus stop. And the blood is still wet. No police tape, nothing. There was a shooting here last night. Somebody got hurt. Then the women often would turn the camera on themselves. The woman on the upper right-hand side, she said, I want the whole, she has the camera. I said, use the camera as your friend. Your camera is your voice. She turned it on herself. She says, I want the whole world to know my baby's father hit me. Photograph on the left, those are bruises caused by her own mother. What are your priorities, I asked. Thinking that maybe we would talk about food stamps, but no, they want to talk about violence, depression, the insanity of their neighborhoods and their environments. And this is a self-portrait by Erica Smalley. If you get on the web, you can look at it for a longer amount of time, but you can see there are tears coming down on either side of her face. I didn't instruct anyone. I just told them how to use the camera. What they did with it was their own story. Very, very intimate. These are things that we don't learn about necessarily. We're not learning about this in school, are we? Do we think about this when we're thinking about what's our next nutrition education program? This is a photograph that was given to me by Barbie Izquierdo, but this is the kitchen of Joanna Cruz. Barbie gave it to me. She said, this is the first photograph of my first Witnesses to Hunger participant. I had no idea what they were going to take pictures of. This is a doll. It's not a human being. Barbie gave the camera to Joanna to take of her kitchen. So Joanna remained anonymous for a time. Again, this is 6 years ago. Joanna was living in her house with no running water and no electricity at the time. And the reason Barbie knew all about it was not only did she and Joanna kind of grow up together, but Joanna would come over to Barbie's house to use the toilet and borrow water, etc. Barbie Izquierdo said, living in situations like this, you can see how families go hungry. Joanna Cruz was living in this house with the father of her 2 kids, and her 6-year-old and a 2-year-old. She said, we spent all of our time at the emergency room, Mariana, because of the rashes and the colds and the headaches that they had. They're sick all the time, and I know it's because of the way I'm living. All right, and then we started to track. When we did the photographs, what I would do is I'd come to the house, I'd download the photographs, then we start talking about the photographs, and it's about the experiences and the stories, what's happening in your life, why did you take this picture, what do you want people to see, what do you want people to do about it. So we started analyzing the transcripts for exposure to violence, because the safety and housing were tied for first place. Food was probably the 5th or 6th concern. Safety and housing. All right, so let's just see what's going on with the violence thing and see how it relates to, we know the food insecurity status, okay? So the orange bar is the households that are reporting low food security, right? That's the food insecurity without hunger. The orange or the red bar is very low food security, formerly known as household food insecurity with hunger. So we had this way of thinking about short-lived violence. Well, there are 5 things of violence, but the short-lived violence was witnessing an uncle getting shot, things like that. Long-term impact of violence, that would be oftentimes being beaten up by their caregivers or by a brother, or being threatened themselves with a knife or a gun or the fist. And life-changing violence we consider to be things like rape, sexual molestation. And you can see that if a mother had reported very low food security, she was far more likely to report these severe forms of violence. So back to trauma and adversity. Trauma causes these neurological problems. It changes the brain landscape. It causes mental health problems, poor self-regulation, emotional regulation, inability to focus. People who have experienced trauma and adversity can be triggered. They can have flashbacks, hyperarousal, and very disrupted eating and sleeping. And I saw that just the other day there's a new publication on food insecurity and sleep. I guarantee you it is related to the adversity, which most of the researchers are actually not really measuring. Why? And that's maybe because we're not talking long enough to our participants and giving them the control that they need to be able to describe what's going on. Obviously, exposure to trauma affects the financial stability of the family, not to mention the educational outcomes. These are some of the photographs of the kids that the ladies of witnesses took. Lots of happy photographs as well. I just happened to be going on to the Undiscussables. I want to introduce you to another measure that I use called ACEs, Adverse Childhood Experiences. Not only was there violence going on sort of in the home while we were talking, not while we were talking to the families, but intimate partner violence, recent violence. When we started to ask about their childhoods, we started to learn that there was a lot going on when the mothers were growing up, when the mothers themselves were kids. Okay? So there's this measure called Adverse Childhood Experiences, and I want to show you some of the questions. So there are 3 categories of adverse childhood experiences with this particular measure. There's abuse, there's neglect, and then there's household instability. So here's the emotional abuse is, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid you might be physically hurt? That's just an example of one question that we ask families in the emergency room at St. Christopher's Hospital for Children and in our other research. Then there's physical, there's neglect, it's emotional and physical. And then in household instability, there's parental separation. We often think about that as abandonment. Abandonment is sort of in that question. Did they witness their own mother or stepmother being abused? Were they exposed to someone in the household that had a mental illness? Were they exposed to someone who had substance abuse? Was someone in the household incarcerated? Okay, ACEs. ACEs is related to all different kinds of health outcomes and diseases, and it's controlling for everything. It's controlling for income, public assistance, participation, geographic region, all of this stuff. And ACEs is related to heart disease, diabetes, obesity, hepatitis, alcoholism, promiscuity, fractures, low educational attainment, poor job performance. Okay? ACEs. Now when you go back to your desks and start reading some of the research, you can start seeing ACEs stuff everywhere. And maybe many of you already know about it. So we started to pick up ACEs in our Children's Health Watch survey. I'm the only site that's been doing this because I'm convinced that trauma and adversity is actually driving the food insecurity rates. And so not only do we ask families about food insecurity, food stamps, WIC, etc., all that nice stuff that I showed you at the beginning, all of the discussables, then we started about asking each caregiver of a young child about that caregiver's childhood experience. Okay, I'm getting the intergenerational transfer of hunger. Just reminding you about toxic stress. Don't forget, affects the brain. All right, so in a publication that we're getting ready to put out pretty soon here, we have about 1,200 people that we've talked to. And I want to show you adverse childhood experience by food insecurity status, okay? So all along the bottom, you'll see emotional abuse, physical abuse, sexual abuse, physical neglect, emotional neglect, etc. Incarceration, that's the one on the last one on the right, household member in prison, okay? Yellow is food secure. This is pretty bad in and of itself. Look at the emotional neglect, 19%. Watch emotional neglect. All right, low food security. Oftentimes, most food security researchers don't even actually break this up into severity. They just look at food secure, food insecure. I highly recommend breaking it up. Low food security. Watch emotional neglect. Very low food security. 56% of the caregivers that reported very low food security described themselves as being emotionally neglected when they were kids. Let's see, emotional abuse, 39%. Substance abuse in the household, 44%. 39% reported having a household member that was in prison when they were kids. Okay, this is the context in which many of you are working, and maybe you already know about this, but this is what's going on underneath in the families that you're working with. Makes you take pause, right? This is actually a photograph from, oh yeah, I forgot to say we have witnesses in Providence, Rhode Island. This is from a mom in Rhode Island. We call this child Buddha baby because lots of times we have to go over and just stand next to her and think about what's going on or to try to heal our minds, right? Several years ago, as an advisor to Sesame Street, I have to say that I think that that's probably the most effective nutrition education out there. Why? Because they really need lots of friendly, furry friends. Not just to teach them about food, but to teach the children that they're loved, they're cared for. And to show the families that they are loved and cared for. Because lots of times when you have a family with young kids and they're reporting food insecurity, it's very likely that that parent herself or himself had a really bad childhood, really tough time. Years and years of adversity. Food insecurity is a measure of years of adversity, not just what happened last year or in the last 30 days. So I don't have answers for you on what this means for nutrition education. What do we do at the Center for Hunger-Free Communities and through Witnesses to Hunger? We basically work with the parents as leaders to tell us what they think they need. It's a lot of fun. It's quite empowering. And here we are in New Haven, getting ready to go to an exhibit. And these are all 5 of these, or 6 of these ladies are from Witnesses, getting ready, walking in, feeling pretty confident. Tiana Gaines in the middle talked about, I used to bring her with me to the Institute of Medicine, National Academies, to talk about the relationship between food insecurity and obesity. She goes, Mariana, I'm so sick of doing that for you. I'm not talking about it anymore. I'm just done with it. I hate it thinking about it. I'm going to get a juicer and make my own juices. And then she started losing an enormous amount of weight. I'm not a nutrition educator. I didn't do anything to tell her how she should eat or how she should not eat. I did nothing, with the exception of giving her an opportunity to start talking about her own priorities. Then she developed a stronger sense of self-efficacy, self-mastery, and control, and then started to take matters into her own hands. And then taking over the mic, there's Imani again, Senator Casey, Tiana Gaines. That type of self-mastery and control is what I think improves nutrition, improves mental health, improves your sense of power. These are the ladies at the Boston State House, loving what they do. And sometimes they're even eating better. And I'll stop there and take questions. Thank you. Am I allowed to take questions? Okay. Or comments? Reprimands? Yes, ma'am, in pink. Good. Sure. I'll repeat the question for those of you who couldn't hear it. She's involved in nutrition education K through 12, and you're trying to get the caregivers involved. What are some ways to get the caregivers more engaged, because it's very hard to get them to show up and to get engaged with the program? You are not alone, as you know. I think that having financial incentives is really big. And you'd be surprised at the little amount of financial incentives that people will show up for. But absolutely, you've got to provide tokens or transportation. I think having opportunities for enrichment for their kids while you're working to educate the parents. Food, and I don't mean just snacks, I mean actually a full meal that's served nice and warm, and that doesn't, you know, the parents that I work with, and it's very possible that they self-select, so these are the parents that I work with that are willing to speak out. They really do not like being told what to do. They like being able to explain to people what they think we ought to be doing. So if you turn to them as experts, we'd like to hear from you about your priorities, your experiences, your solutions, then going from there. Because basically parents see that you see them as a means to an end. And they do not want to be seen that way or felt that way, humiliated. They are humiliated in so many avenues. If you can create opportunities for them to feel, to be recognized as experts, as powerful parents, parents who have the answers, and you can provide financial incentives, transportation, childcare, good luck. Yes, right behind. Okay, the question was, what is the role of food banks and food pantries in this? Is there a role for them, and do parents see these as helping, as people who are on SNAP and WIC also go to the food pantries? I see that, I think that food pantries are doing an enormous service. They are a place where people go not just to get food, but to go and get food for the mind. So it's not just sort of food for the body, but food for the mind, because they, depending on the food pantry, they may go because they like the volunteer that's working there, or they may like to go to see some of their friends who are waiting in line. I think the quality of food, as you know, is always tough, especially when diabetes is highly correlated with food insecurity. Those who are diabetics don't have a lot of choice at the food pantries, and that could be very problematic. So I think the quality of the food is really important. And I also think that food pantries and food cupboards can do more to make sure that the environment is embracing and nurturing and like a sanctuary, not in a place where you have to wait in line and show certification of your income and of your zip code. It's humiliating to wait in the lines, and most of the families that I work with have utilized those food pantries, but they hate them. Because if they hate the ones where they are treated poorly and treated like a cog in the wheel, treated like a number, treated as an adversary. So the more you can do to reduce the lines, reduce the paperwork, and improve the feeling of sanctuary and nurturing, you will be providing a healing environment, and that is restorative justice. You need to be creating a place of restorative justice, because food is not the only thing that the families are dealing with.